Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's Wednesday COVID-19 news conference for the latest in COVID-19 information for our community. Let me go ahead and briefly introduce who is on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, City of Amarillo Public Health Director, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We're going to open it up to our panel to make some brief statements, and then we will take questions from the media that are in attendance. Let's go ahead and start with Amarillo Mayor Ginger Nelson. Mayor, how are you today? Good morning, Mayor. How are you?
Mayor, we're not hearing you.
Yeah, we can't hear you, Mayor. Well, obviously I have a few technical difficulties here. Let's just pause just for a second. Yeah, Mayor, we are not hearing you yet.
Dave, I'll troubleshoot with the mayor if you'd like to go ahead and just move on with
Move on to go to Casey Stoughton, Health Amarillo. Casey, how are you?
I'm well, Dave. I'm always just glad to be here and to welcome our community to the press conference. It's always a pleasure to visit with you and to see our community. To talk about the numbers, we had, as of yesterday, we had a total of 26,207 total cases of COVID-19 reported in our community. 13,878 cases were in Potter County, and 12,329 cases in Randall County. We have a total of 18,257 recoveries, and we are really thrilled about each and every recovery. We have to report 381 deaths as of yesterday, and we are heartbroken at each and every death. That leaves us with 7,776 active cases. Each of the cases do represent a unique individual. The total rolling 7-day positivity average for Potter and Randall counties is at 17%, and the positivity rate at the drive-through testing site is at 47%. I think it's important to note that the positivity average at the drive-through testing site is just a subset of the total positivity rate for the entire community. They're at 17%. The 5-day new case average for our community is at 471 new cases per day. The public health drive-through testing site does remain operational, and individuals can call 378-6300 to be screened and directed to the test site. Our community remains at status level red. Conditions remain consistent as all indicators are over that threshold for status level red. GA32's hospitalization rate for the 25 county Panhandle RAC region has been over 15% for over a month now. Yesterday's hospitalization region for the RAC, that 25 county region, was at 36.4%, meaning that just over 36% of all hospitalized patients had COVID-19. We do have good news on the vaccine front. Two manufacturers, Moderna and Pfizer, have submitted EUAs to the FDA, and those emergency use authorizations have been approved. December 10th through the 14th, there'll be 2 additional meetings. The VRPAC and the ACIP will meet, and with their approval and recommendation, we anticipate vaccine to be shipped later this month. The expert vaccine allocation panel is working on a prioritized allocation distribution plan for the first phases of distribution of that vaccine, and we anticipate that the first to be vaccinated in our communities will be the hospital staff. They're caring for the sickest of patients, which is really what we expect as we are trying to ease hospital capacity and save lives. City staff, along with Northwest Texas Hospital, BSA, Texas Tech, will be standing up an outpatient infusion center between the 2 hospitals sometime next week. We're working with the RAC to request all of the needed resources for this project. The outpatient infusion center will be operational, like I said, next week, and we will communicate with community providers as we're closer to an opening date, as patients will be seen on a referral basis only. This is the end of National Influenza Week, and so a great reminder to get your flu vaccine, wear your mask, limit gatherings, and say thank you to a healthcare provider. They worked tirelessly taking care of us, and so we certainly appreciate all of their work. Thank you, Dave.
Thank you, Casey. Let's now go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you today?
I'm good. How are you, Dave?
I'm good, thank you.
Good. Casey said it very well this morning, and I briefly just wanted to reinforce what she said. Clearly, the most important thing now is to continue to wear your mask and practice social distancing. But it looks like the plans to distribute the vaccine are taking shape. And as always, our hospitals are the priorities. Since this started, what we've always stressed and will continue to stress is to keep our hospitals running as efficiently as possible. And so that will be our priority. And certainly my priority as a health authority is to make sure that the hospitals receive that vaccine first to be dispensed to those workers that need it most. So that's basically all I have to say, Dave, and everybody stay safe out there.
Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you today?
Well, Dave, I'm saddened today. We've talked about just how much this last month or two has been pretty challenging for the hospitals. But sometimes you don't realize how bad the situation is until you put some objective numbers to it. So I wanted to review some numbers put together by Ryan Chandler, our CEO, just about our experience at Northwest since the pandemic started. So if you look back from March 18th to July 31st, so that's the springtime, that's 4.5 months, we had 323 confirmed COVID patients. We had 32 deaths at that time. And that was a death rate of 9.97%. Now, if we contrast that to this winter, so now let's look at August 1st to December 3rd. So that's a 4-month period. We had 803 positives. That's almost 3 times the number we had in the spring. We had 108 deaths. That's over 3 times what we had in the spring, for a death rate of 13.07%. Now, if you focus on November, and we've said November has been by far the worst month we've seen. In November, we had 424 COVID admissions. That's 424 out of that 803 from August 1st to December 1st. And out of that, we had 76 deaths in November. So that's 76 out of the 108 we had in that 4-month period. So that gives us a 17.9% mortality rate for November. Terrible number. You say, what about December? Right now, we have had 24 deaths in December thus far. If you calculate that out or predict that out to the end of the month, that's going to put us at over 80 deaths for the month of December from COVID-19. So these, this is sad. These are families that have lost members. Some families have lost multiple members to this virus. So something has got to change. And thankfully, as Casey pointed out, hopefully the change is coming in the form of these vaccines. Now, we have every reason to believe that this community may receive vaccine as early as next week, which is very exciting. And as Casey pointed out, that first allocations under the DSHS tier system are to be for frontline healthcare workers and first responders. Now, what we know is that this is a Pfizer vaccine, takes 2 shots separated by 21 days. And the biggest thing is we know that when you get the vaccine, over 50% of people can expect developing flu-like symptoms for a day or 2 afterwards, and significant flu-like symptoms. So one of the things we're looking at the hospital is, how do we stagger our staff getting this vaccine so we don't give it to everybody and have everyone call in for the next 2 days when they're sick? So that's part of the challenge of how to do this vaccine. The good news is some of the early reports are saying that as early as 7 days after the second immunization, you may be immune to COVID-19. That's incredible. What an amazing vaccine. So hopefully that's true. And we're talking about maybe within a month, we will already have a population of people immune to COVID-19 from this vaccine. Now, as Casey also mentioned about this infusion center. So the drug we're talking about is bamlanivimab. This is this antibody that's made by Eli Lilly. It's for outpatients. It's for people who are at significant risk for getting sick from COVID-19. Now, what we were told initially with this medication is that we would have to treat 14 to 15 individuals in order to avoid one hospitalization that would lead to a severe COVID illness. We have now given 32 people this antibody in infusions. And what I'm finding is overall, people tolerate it very well. We've had no adverse reactions to the actual infusion itself. And then talking to some of these individuals, they said they started feeling better within 24 to 48 hours. That's really exciting. This antibody is against the virus in the blood. Now, what we're doing is, because this is under experimental use, so we have to be very strict on who we give it to in terms of meeting the requirements, we're asking that physicians refer their patients to us as opposed to patients calling directly to the hospital. So we're taking referrals from physicians as to who they think are high-risk patients that would meet the criteria for this particular antibody. So the exciting thing is we have some good tools now that hopefully will start to turn this trend around that we've been seeing over the last 2 months. So let's talk about the numbers in Northwest. Today, we're at 111 positives. In the last 2 weeks, we've been typically 1-teens to low 120s in terms of number of positives. Now, at 111 positives, that's 22% of our licensed beds, or it's 39% of the number of patients in our acute care hospital. We have 45 of those patients are in the ICU setting, and 22 of them are on ventilators right now. We're currently using 25 of our ventilators in total. Critical care remains our biggest challenge. And I can tell you this morning, we are aware that there are 18 critical care patients out in the region who are waiting to be transferred to a higher level of care. So that's been the big thing, is trying to take care of these patients, particularly in these regional facilities that have never been necessarily set up for critical care patients. Now, our outpatient testing, yesterday we did 259 tests. We had a 12% positivity rate. That's exciting. Overall, we're looking at, over the last week or two, we've been in the teens to low 20% positivity. A month ago, we were in the high 20s to low 30s. I may be able to argue that we're seeing a trend of reduced number of positives in terms of percent positivity in our outpatient testing, and that would be a good sign if that is true. Now, in terms of inpatients, the tools we've been using, the other one is remdesivir. That is the antiviral that was approved by the FDA. Currently, we have treated 550 patients with this medication. Currently, we have 25 patients on it in the hospital. We have enough in storage for over 40 more patients. We've really had no challenges getting this particular medication at this point. When it comes to surgeries, right now we're still on a case by case, where if we can do an elective surgery and that person doesn't need a hospital bed, we're happy to do that procedure. But the hospital beds, and particularly critical care beds, are the limiting factor in us being able to do some of these elective procedures. And then with regard to PPE, we're in great shape. I'd just like to end with, once again, as everyone has done, is to thank our nurses and all the healthcare providers that have been doing a tireless job of taking care of these patients. In particular, we've had a lot of these nurses coming in through the RAC, the Regional Advisory Council, and they've done a great job for us. So it is tireless work. As we head into the holidays, I know many people would like to have a break and be with their families. And for a lot of our nurses, that may not be an opportunity, but they do an incredible job for us. That's all I have. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Emmentier, Chief Medical Officer for BSA. Emmentier, how are you?
I'm good. Good morning, David, and good morning, Amarillo. Thank you, everybody on the panel, for joining us today and providing feedback. You know, today at BSA, we are continuing to have very high numbers of COVID inpatients. We're a little bit lower than we were personally in terms of our COVID volume over the past week. Today, starting the day at 154, again, 154 hospitalized COVID patients, which is the highest number in the city in terms of where we have patients housed right now. With that being said, it's a little bit lower than where we were previously. Again, we're having a significant taxing on our intensive care services, having right now the ability to handle 94 intensive care patients in terms of bed capacity. And today we're at 82 of those beds filled with intensive care patients. So a very high utilization rate on our intensive care beds. And again, remember that this is because we expanded that capacity significantly beyond what our historical capabilities are. Typically, we run a 48-bed intensive care unit. And the fact that we have 94 intensive care unit beds now should make it very clear to folks that the only way we're able to do that was by enhancing the number of RAC nursing staff we have here and having our own full-time, part-time, and PRN nurses working additional extra shifts, which they've been doing for 9 months or more for us to be able to handle this type of volume. So although it's a little bit encouraging that we're down from that 200 number, 154 patients with that burden of ICU is still significant. 67 of those 82 in the intensive care unit are COVID-19 patients. So just to give you an idea. When you look at the numbers that we've had coming in and out of pure COVID patients, for the first 6 days of December, we had 131 new COVID patients admitted, and we discharged 143 patients. So everything we brought in, we pushed out a few more. But as Dr. Weiss mentioned, our death rate is also higher these past 2 months than we've seen since the beginning of the pandemic. It's not exactly clear why that is. I think there are theories about why that could be. It's not because the therapies have changed. We're giving the same aggressive therapies that we've given previously, including dexamethasone and remdesivir at the forefront of that therapy. It may be because the disease is affecting people with more comorbidities that are of a more advanced age, that are the greatest risk population, certainly. But as early as the first 6 days of December, we have very similar mortality numbers as Northwest Texas Hospital does. So I think what we're trying to tell you is that the risk for this disease to progress through the winter and have a major impact on our city and our citizens certainly still exists. When you talk about the things that we are looking forward to, the vaccine preparation is probably the biggest thing. We have been planning very aggressively here at BSA with our leadership teams to have a mass vaccination strategy for our employees, which has been tiered to put those people that have the highest risk for being exposed to COVID at the front of the list for vaccinations. And we're working through that so we can vaccinate hopefully several hundred people per day. And as the vaccine is allocated to us, be able to get those folks treated very quickly. Clearly, the vaccination is voluntary. This is not something that folks are required to take. We all believe in the scientific community that this is a highly effective vaccine. We are planning, I know myself, I am planning to take the vaccine. I know most of our physicians that I've spoken to and nurses are, but I'm certain there'll be some folks that are going to not want the vaccine and they're not going to be mandated to take it. That's part of the requirements under the government's early use authorization, is that this needs to be a voluntary option for folks. But again, looking at the early data, I think all of us on the call today with medical background and training would say that the data looks very exciting in terms of the efficacy, and the side effects appear to be very typical and common that we would see with most of the vaccines that have been well established. From a standpoint of the infusion center that was mentioned by Casey and then Dr. Weiss as well, we are excited about the potential to have more patients offered the monoclonal antibody therapies. We have started doing some of that therapy administration at our urgent care center, and we're doing that under the initial attempts to get the drug prepared, to get the equipment we need to do so, and again, working with the city leadership to have that be something that is moved into a more large-scale operation in the tent structures when the volume is there. We plan to start having that be offered to our partners in the community as well as a community resource once we have the equipment and everything else fully ramped up. From a standpoint of elective cases at BSA, we are continuing to scrutinize our surgical schedule. We have asked our surgeons to attempt to postpone and push off any surgeries that are not absolutely essential at this time. And they have done an excellent job of working with us to do that. These are some difficult decisions at times that have to be made about what surgeries can and cannot wait. And therefore, this is a case-by-case analysis. It's not something that can be done simply by looking at the type of surgery that's performed. We do feel good about how that's going forward, and we do feel good about how we're working with patients to explain to them what we need to do in terms of potentially pushing back their procedure. From a standpoint of personal protective equipment, we also are very well stocked at this time. We feel good about where we are, especially when we compare today to where we were back in the spring when it came to PPE. There's always an issue where we have a potential single item that's an upcoming potential shortage, but the RAC resources have helped us out there, as well as some of our community partners, and we're very appreciative of that. So again, I think right now, if we were to kind of look for the next several weeks ahead, I think we need to be cautiously optimistic about where we are with the vaccine and the timing. I know we're excited about it here at BSA. I think we need to be cautiously optimistic that our numbers will not get much worse than they are now. Certainly, we're concerned about that. We've got to continue doing our due diligence when it comes to protective measures with masking and social distancing. There's no question about that. We need to keep our families and our friends safe throughout the holidays. We need to be able to, as a medical community, continue to provide care for the citizens of Amarillo. And the only way we're going to do that and have the capacity to do that is if we're helping to keep the COVID numbers down in the hospitals over the next couple of months, until hopefully we get a large portion of the public vaccinated over the next 2, 3, 4, 6 months, which I think our government is trying to really help us in terms of mass production of vaccine. So thank you for everything today. Thank you to the nurses, the doctors, the therapists, everybody working front lines to take care of our COVID patients. I know we say this every week, but we mean it from the bottom of our hearts. You guys are the reasons that we're doing as well as we are right now when it comes to the outcomes we're having with our patients. Thank you.
Thank you, Dr. Lamentier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you today?
Doing well, David. Thank you. You know, when I start here, the first thing I'm going to do is I'm going to read a short little thing that Dr. Richard Stone, who's the executive in charge of the VHA, sent out to all employees this week. VHA is the Veterans Health Administration. It says, while our lives are different, we still see optimism among our colleagues and fellow veterans. We are hopeful that the vaccine may be approved as soon as this week. We are looking forward to implementing our plan to rapidly distribute it. There is always hope. We can see a light at the end of the tunnel. And what I found is very inspiring because of all the work, and as was mentioned by the panelists prior to me, that the healthcare workers, our first responders are doing in responding to this, but also that we see some glimmers of hope with the vaccine and the treatments that are out there. However, what we still need to do is continue to do those precautions that we have echoed about for months. I mean, I've been here since June, but I know they've been echoing about it since all this started, is wearing your mask, practicing social distancing, good hand hygiene, and as Casey referenced with influenza, get your influenza vaccine. Those are all very important. You know, as we look at that COVID vaccine, you know, I plan to get it. You know, as soon as the VHA says my priority group's up, I plan to, you know, roll my sleeve up and get the vaccine. And so it looks like it's very efficacious, very effective, and very safe. And so I do encourage people now, as Casey mentioned, it's an emergency use authorization. Everybody will have to make their own choice, but I would encourage as many people, when it becomes available to you, is that you strongly consider getting the vaccine. So a little bit about our numbers. Today in our hospital, we have 16 COVID positive patients. 7 of those are non-veterans. As mentioned a couple of weeks ago, we have we got approval to allow us to take care of non-veterans and assist the community. 9 of our patients are in the ICU, and 5 of those non-veterans are amongst those 9. In total, we've taken care of 20 non-veterans to date. And so we are honored to be able to do our part in helping out the community. As I know, our focus is on the veterans first, and we continue to do that. But when we can to assist the community has been a great honor and privilege of us. The next thing is, you know, with all the surge of taking care of these inpatients and stuff, we have had to move some of our staff around. And so we've had to reduce the number of outpatient clinic appointments available and face-to-face. We still are offering virtual and telephone and video, but I know our face-to-face we did have to reduce. I do want to remind veterans, we do have free COVID testing for veterans. If you think you would want one or you have symptoms, please call our call center, talk to the team, and we'll find out what we need to do to get you tested if it's appropriate. Couple more things. I just want to remember this week we lost a true Air Force leader. Person out in front is Air Force General Chuck Yeager, passed away this week. First to break the sound barrier. You know, I know my Air Force colleagues want to mention Air Force, but I will say as an Army veteran, he started out in the Army Air Corps. I have to throw that out there. But, you know, really first to break the sound barrier, he was a World War II fighter pilot ace, and really embodies that greatest generation that we talked about previously. I want to especially not just only thank the healthcare workers, as is mentioned before, but I want to thank the fellow panel members here. It takes time, it takes information, but it's important that we notify our community and the public of what's going on and give you whatever information we can. And so I thank you for taking the time out of all of your busy schedules. It's not like you're fighting a pandemic right now and you've got a lot of spare time, but to be able to take this time and get together. And I know there's other times we're getting together to discuss things, but just appreciate you. And I know I'm getting ready to pass this off to Jared Miller, who's an honorable Navy veteran, but as a West Point graduate, I would not be appropriate this week to not say, go Army, beat Navy, look forward to the game on Saturday. Thank you to City Amarillo, my fellow veterans.
Okay.
Thank you, Dr. Gonzalez. We'll now turn it over to Jared Miller. Jared, how are you?
Dr. Gonzalez, amen, brother. I can't say it any better. You fight on one team, but on one day of the year, you root for your team. All right. Just want to remind everyone that drive-through testing center remains open. If you have symptoms, if you're sick and you have symptoms you feel might be coronavirus, please call Public Health Hotline at 378-6300. You'll be evaluated for referral to the drive-through testing site. Drive-through testing site is still operating, still conducting lots of tests. Also, if you are referred for a test at the drive-through testing site and you don't have transportation, Amarillo City Transit is available to help. Please call Amarillo City Transit at 378-3095. They will arrange free transportation to and from your test. We don't have barriers to being able to get a coronavirus test if you have been referred to the drive-through testing site. We are operating under a number of guidelines right now, from the CDC to the Department of State Health Services to the governor's executive orders, GA 29 and GA 32 specifically, most specifically with regard to the city. There are others that are still in effect as well. In addition to that, we've got the governor's checklists for operation, and we've also got now the COVID-19 pandemic emergency response measures ordinance. So at this time, after months of discussing what the safety protocols are, what the operating protocols are for businesses, what the checklists for being able to safely attend or go if you're a patron, and what the checklist says about the requirements for sanitation, for cleaning frequent touch surfaces for employees and staff wearing face coverings at all times, for if you're a patron, for when you're supposed to wear a face covering when you're inside a business or when you're out and about. This is stuff that we have learned over the last number of months, and I will say that I've seen a marked improvement over the last couple of weeks in people wearing their face coverings. There's still opportunities for improvement. People have asked if we've gotten a lot of complaints. We've gotten a number of complaints over the last couple of weeks, especially since we've done the pandemic emergency response measures ordinance. And all of the businesses we visited with have been very responsive for the most part. So I just want to commend our community for stepping up and taking this more serious. I think we can all say that we've seen a better adherence to wearing of face coverings when we're in all the situations that we're directed to wear the face coverings. There's still an opportunity for improvement, and I want to implore everyone to improve there. I've been also asked, are we going to require vaccines be taken by public safety, public health, and other essential city personnel? No, we're not. At this point, we're not intending to require vaccines to be taken by any essential personnel in the city that work for the city of Amarillo, even after those vaccines are approved even after they're approved. Our public safety personnel and our public health personnel, while we experienced a number of positives early on, we have really worked with them, and they've been incredibly responsive and incredibly responsible. We're not seeing a lot of transmission in the workplace. Where we previously saw transmission was from family exposure and from community exposure. They recognize that they are leaders in our community, so they're taking it very serious, the face coverings and everything, not only when they're at work, but also when they're out and about, going about their daily lives, not on the clock. And not only our employees, but their family members are doing the same. And that has shown a dramatic reduction in the number of positive cases that we have in our essential personnel, which is something we track very closely. Dave, that's all I have. I'll answer any questions.
Thank you, Jared. Let's now go to some questions from our media members who are in attendance. We have a question for an individual panel member or the panel as a whole. That's completely fine. Let's go ahead and start with David Gay of Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody. I guess my first question is about this infusion center that has been talked about. How with the implementation of this center between BSA and Northwest, how does that affect the amount of the antibody that will need to be either purchased or given to the hospitals for that center to be successful?
I guess, David, I can say, so David, we cannot purchase it. So it is under EUA. So it is being allocated by the government from Eli Lilly. So that's, as you point out, that's always a limiting concern. I think we have, I want to say we've got about 225 more doses. We've given 30 doses, but we're really dependent upon the allocation coming from the government.
Absolutely. So with that, does the establishment of this center, I guess, affect that allotment in any way? Could it increase the allotment with the establishment of this center, or will it just remain the same, or is that known yet?
I certainly don't know. I don't think it'll change, because I think Dr. Lamentier has gotten some from at BSA. So I think it's being directed at the two facilities, and then we would have to obviously share it in terms of this infusion center for the community. So that's really coming to the individual locations right now.
And Dr. Lamentier, how much of the supplies do you have at BSA?
We've got a very similar number in terms of our allocation as Northwest. One of our concerns is that again, attempting to coordinate the space, number one, potentially at the hospital, if we do any of it there for appropriate outpatients, and then number two, at our urgent care clinic. And then number three, the tent strategy. With that being said, we feel like if the potential demand ramps up, the tent strategy may be the best location for us to take care of a large number of patients over a more brief period of time, if you will. Again, partly because all of our resources are so heavily being taxed to manage the acute care population. The administration of this drug and the monitoring thereafter takes several hours. So having patients do that at a location where we're trying to take care of those that are more ill, that require hospitalization, is part of the reason why we felt like the tent strategy could be a better alternative for us.
Absolutely, absolutely. And the next question that I have is regarding vaccines. There's been a lot of talk on the call about the potential distribution of vaccines. I guess, what are the plans that the city and the public health department, as well as the hospitals, have for distributing these vaccines? Is there going to be a certain place where these vaccines are distributed? Will it be through the hospitals? Will it be through a separate site? Can you talk to me a little bit about that?
I would think the plans and the intention of the city, and certainly of me, is to make sure that the hospitals have the first priority and receive the vaccine as soon as it becomes available.
I would add, we are pre-positioning vaccines. They're in the process of that right now. We have a vaccine distribution plan. Casey Stoughton and the mayor are actually on a call right now, addressing some questions and coordinating vaccine distribution. So there is a plan in place. We are working to implement that plan. There is a prioritization that's very clearly published by DSHS that also follows CDC guidelines with regard to which persons are prioritized to receive the vaccines first. Obviously, the doctors have all noted public health care personnel that are working directly in care of patients are the very first. So that's something we're working on right now. So there are good plans in place. We are following those plans. And I think everyone's going to need to be patient because those identified as priorities are going to have to get those first because of those vital roles that they're providing.
Absolutely. And I guess the last question that I have on that is the city recently released a news release about healthcare facilities, providers throughout the area signing up to be a provider for once the COVID-19 vaccine comes out. Why is it important, in y'all's opinion, for these healthcare providers to apply to become a provider for the COVID-19 vaccine once it becomes available?
Well, I think it's important because as time goes on, there's going to be more and more vaccine available for the general public, and my intent is to offer that vaccine as much as possible to people in our community that want it. And the best way to do that is try to get our community behind us and be offered as providers of that. Pure and simple.
Also, from a registration standpoint, from a logistical standpoint, part of that registration process includes identifying the storage capacity, the treatment capacity, the training levels of different personnel in that doctor's office. So that'll help manage the distribution and allocation of those resources when they're available.
Absolutely. That's all the questions I have. Thanks, y'all. I appreciate it. Have a good rest of your week.
Thank you, David. Let's now go to, if I'm not mistaken, Aaron Langston of KEMR Channel 4. Aaron, how are you today?
Pretty good. How are y'all?
Good, thank you.
First question is, the hospitals talked about having a plan in place. Can you go into more detail as to what that plan is for when the vaccine is available for your staff?
So I guess Dave, Aaron's right. I can start in terms of Northwest. So we expect a fairly limited allocation for the first one. So what we've set up is a system where we will actually schedule individual employees. So they'll go into a database. They'll actually schedule a time for them to come. We have a certain number of slots per every 20 minutes or every 30 minutes. You actually have to fill out a questionnaire because the important thing is with these vaccines, the state is holding the second dose, the dose for 21 days. And the only way they'll release that is if we submit each recipient into what's called the MTRAC system, which is the state's immunization tracking system. So a person will get their vaccine, we'll have registrars that will confirm their points of information, and then they'll enter that into the MTRAC system. So we're anticipating that we may be able to immunize as many as several hundred patients a day or employees a day under this system. And then we'll have to have them come back 21 days later. And that's going to be also essential, is that we get all those employees entered into the system so we get that second vaccine for them to receive it 21 days later.
We're doing the same process at BSA. We're still waiting on the absolute confirmation of our vaccine arrival at BSA. And with our, again, over 3,000 employees, we have been working diligently to plan and coordinate how we're going to vaccinate that large number of individuals based on a hierarchy that is modeled pretty much exactly as the state vaccination panel has recommended we proceed with that hierarchy, meaning those folks at highest risk at the top, those that are still working at the hospital in some capacity that are not as directly in touch with patients are a little bit more toward the lower end of those tiers, but all still hospital workers in that big bucket of individuals that need to be vaccinated first, as opposed to those folks that are in the ambulatory setting. So yes, it is a coordinated balance of building out the scheduling structure in one of our IT programs that we're utilizing, getting our nursing and clerical staff, the clinical people that can administer the vaccine with the clerical folks that are going to be able to enter all of that mandatory data and that IM tracker that Dr. Weiss mentioned. That's a requirement by the state. We also have to make sure that people are understanding the consent. We're going to be distributing that out ahead of time and making sure that they understand what they're signing on for with the vaccination. So all those things that are critical components of a successful vaccination program requires a lot of planning, requires a lot of resources, and we are working diligently to have that all coordinated. We had another large meeting today to discuss those details, and I think we're moving forward pretty nicely, anticipating that we hopefully get vaccine early next week.
Did that answer your question, Aaron?
Yeah, that's perfectly fine. You said that could see it as soon as next week. Has there been any timeline on when non-essential healthcare workers might be able to receive the vaccine?
I would say, Aaron, what we're hearing is that that may not be until the spring, literally March, April, even May, in terms of just opening up immunizations for the general public at that time.
All righty. And what are the ventilator usage numbers that you guys are seeing at the hospitals right now?
We currently we have a total of 70 ventilators. We've expanded our capacity with the rack being very helpful in terms of giving us additional vents. Today, out of those 70, we're using 41, so right about 59% utilization rate on ventilators. And I'm looking at the ventilator numbers. 38 of those ventilators are occupied by COVID positive patients.
At Northwest, we have 61 total ventilators. We are using 29, 22 of those of which are for COVID patients.
All righty. I think that has been covered. Thank you very much.
Thank you, Aaron. Let's now go to, if I'm not mistaken, Kevin Welch of News Channel 10. Kevin, how are you today?
Hi, Dave. I'm good, thanks. Jared, do you know what the trend for people showing up at the drive-through is for testing? How many people are requesting tests?
I don't know the exact current day trend. I know we've been doing as much as around 200 a day. And every time I drive by there are people there and relatively busy, but I don't have the exact numbers right now. We'll have to get Casey to get that information for you.
Yeah, she snuck
Dave
out.
will coordinate, get that for you as soon as possible after the call.
Okay.
We can do that.
Can somebody describe what actually will physically happen with what happens with the infusion treatment? What does that consist of?
So yeah, Kevin. So basically, this is a monoclonal antibody, meaning it's an antibody. It's a protein that the immune system makes, but this one is all one flavor in that essence. This antibody is against part of the virus. So that's the whole idea. Is it's really ultimately trying to clear or help clear the virus out of the blood, or at least prevent the virus from entering other organs by essentially jamming it up, by binding to it. It's a 1 hour infusion. We found most people have no trouble with this infusion, and then we have to observe the patient for another hour. So it's really a 2 hour process. And like I said, anecdotally, people are telling me that they do feel better within 24 to 48 hours after the infusion.
Okay. And do you expect to need to use the tent immediately? Initially, it was described as a precautionary measure.
I would say certainly at Northwest, just to remind you, this, we have to be very cautious or strict about who we give this to. Right now, it's indicated for people over age 65 or they can be over age 55 with at least one comorbidity like hypertension or diabetes. And then there's some general categories like if someone has a body mass index above 35 or has an immunocompromised state or is taking medications that immunocompromise them. Those are the individuals that we can give this antibody to at the present time. We've been getting some referrals from several physicians, but certainly I think as the word gets out, more physicians will be able to identify the appropriate patients they have. I do expect we'll see higher volumes.
And who will staff the tent?
The tent is going to be staffed by state resources with the RAC. And again, the reason for that is that both hospitals are really maxed out on our ability to provide any staffing to that modality. That was also part of the reason why that strategy was felt to be the best if the volume and demand on that resource was high, which we think it could be, especially if our allocation continues to come in those similar numbers. And we have to dedicate really 100% of our resources to our folks in the hospital where that demand is needed.
There will also be, what I understand, a small number of fire department personnel allocated to that location, along with possibly some public health personnel, but I'm not sure exactly how many.
Okay. And who will make the decision about who actually administers the vaccine outside of the hospitals?
Again, I may not be understanding your question, but so up to this point, I've been getting the referrals. I review the patient's information against the criteria in order to give the medication. And if they meet that criteria, and then right now we've been delivering it, giving it in our emergency room. And then, but that's, yeah, so it's really case by case, looking at the referral and making sure they meet the criteria for administration.
I think, yeah, I mean, I agree with Dr. Weiss on the antibody, that's correct. But if you're asking about the vaccine. Yeah, we don't have purview over what the hierarchy is going to be outside of the hospital. I'm sure that once that information is communicated to Dr. Milton and our public health authorities, we'll have some direction. We are planning to be a site of administration to the public for vaccinations and working with our clinics to make sure that they can be as well. But we need more information about how that's going to work, and we're looking to our state representatives to help us guide us in that plan.
And I think that we're going to be in a uniquely well-prepared position to be able to answer questions like that through the work of our public health authority, Dr. Milton, but also Casey Stoughton, as she serves on the governor's appointed expert vaccine allocation panel. So as those vaccines become more widely available, we're definitely going to be able to communicate how that's going to happen.
So does that mean that the decision will be made at somewhere at the state level about who actually administers the vaccine?
You mean who physically is administering the
right,
the
like
vaccine?
CDC or Walgreens, or not individuals, but where the sites will be.
Yeah, I think that we're going to we'll be able to get Casey to be able to give you some more detailed answers on that. I don't have the answer for that.
Okay, thanks a lot. That's everything. Thank you all.
Thank you, Kevin. Let's now go to Maria Serrano of KVI Channel 7. Maria, how are you today?
Hi, good morning. Thank you so much for taking my questions. I have four quick ones if y'all can bear with me. First one is, we've heard a little bit about the vaccination distribution plan, but I'm wondering how are state and local leaders working together to roll out this plan in Texas, and also how important is it to work together to make this a success?
Yeah, I mean, I can say that all the members on this panel have worked together from the start, and we're going to continue to do that to make sure it's done as efficiently and effectively as possible.
Yeah, and I would add all of the key jurisdictions and medical facilities and emergency management personnel are coordinating on a almost daily basis. We have structured standing calls to coordinate 3 days a week, and we're also having organic meetings as they pop up with all of the necessary personnel. So we're working extremely hard to maintain situational awareness, to keep everyone on the same page and make sure we're pulling in the same direction. We can't replace coordination and working together. So that's you're right, it's essential. We can't go without it.
Thank you. And has the state and city conducted any, say, micro tests or pre-staging to see if the vaccination distribution plan is actually ready to go?
Well, I say, Marie, from Northwest perspective, the answer is no. I mean, we've devised the best plan we can at this point. You know, there's been a lot of variables we can't predict. Is exactly how much vaccine is coming, exactly when is it coming. So we also anticipate a very steep learning curve. So as we get into this, I think with our first experience, we're going to have to be very facile and adjust as we need to in terms of how to best distribute this vaccine. So there's still a lot of variables, a lot of things to consider. And I think we just need to jump in with our best plan and then be ready to adjust as needed.
And we are pre-staging right now. So we're getting ready to begin that process right now.
Thank you. And then three out of the four questions, the third one is, once the vaccines are approved for emergency use, can y'all explain what happens next, like from the vaccines arriving from the state until it's actually shot into a person's arm?
I think basically this first vaccine, the Pfizer vaccine, requires refrigeration at really low temperatures, and so those refrigerators are on the tech campus, and as soon as that arrives, then the intention is that as soon as we get this, tech gets the list and coordinates with at the hospital, that the vaccine is dispensed to the hospitals, and so those individuals who need it first can get it.
Thank you. And then the last question is, what do y'all think will be the biggest challenge when implementing the vaccine distribution plan? And how confident are you that the state and also, our city locally is ready to go?
I guess our biggest challenge is how do you coordinate? So as Dr. Milton said, this vaccine comes in a vial that has 5 doses in it. We know that the minute you resuspend that solid vaccine, you've got a limited amount of time before you can immunize people, before you risk the vaccine going bad. So that's part of it, is how do we make sure we don't waste one single dose of this? So like in Northwest, we're grouping our schedules in groups of 5, so that we know that we have 5 people ready to go as soon as we resuspend that vaccine. But the bigger thing is just how do you get word out to everyone that as to who it's available to, because it is a tiered approach. So we can't immunize everyone up front. So we're trying to find the highest risk people, get them involved first. So it's a matter of communication, scheduling, the logistics of where you're going to do it, making sure we can monitor people for 15 minutes. And then the biggest thing is making sure we get them back in 21 days for that second one. So we have to assure that everyone comes back and gets that second dose. So, as everyone on the panel has said, it's been a lot of work over the last couple of weeks amongst lots of people to try to coordinate this effort so that we don't waste a single dose of this vaccine.
Absolutely. And please, if I can, ask one more, that would be awesome. Just my last question would be, today I saw a story on how UW Health University Hospital in Wisconsin, they're getting ready for the vaccine, and their staff is actually practicing and they're administering, the vaccine by injecting their colleagues with saline. And they're practicing with themselves and also with even like pieces of fruit. So I'm wondering, with Northwest and BSA, this question is directly to y'all. Are y'all doing any type of, things like these, like, pieces of fruit? I mean, that's really interesting. I wonder what the process is there with y'all in this.
I guess, Maria, I haven't seen that article, but I would say this is a standard vaccine. This is an intramuscular injection, which every nurse is probably the first thing they ever learn to do. So I don't know if they're trying to train non-nursing people on how to give immunizations, but in terms of the actual administration of this vaccine, it's no different than the flu shot or the measles vaccine. It is an intramuscular injection, and so our plan is we're going to have nurses only administer this vaccine.
Yeah, that's exactly right. There's nothing tricky or new about how the vaccine's administered. It's an intramuscular vaccination, as Dr. Weiss said, very basic, very straightforward, no different than how the flu, for instance, is administered. The key here is the limited amount of time that you have to use the vaccine that has been suspended with a normal saline diluent. And you have so many hours then that vaccine is good thereafter. And we as well are scheduling patients for that vaccination in clusters so as to have 0 vaccination that day that was thawed left over. So we utilize that completely. And in fact, at the time that we schedule you for your first vaccination date, we're also scheduling you for your date 21 days thereafter. So you get both appointments up front. And it's clear that if you are on the Monday of a certain week, 3 weeks later on that Monday, you'll be coming in for your second shot. That's the requirement.
Okay, thank you guys so much, and y'all have a great day.
Thank you, Maria. That concludes our COVID-19 news conference for today. Once again, I'm David Henry. I'm the Communications Manager for the City of Amarillo. I want to thank all of our panel members who participated today and